Tonight's bedtime lesson is about cold sore. Cold sores are small blisters that develop on the lips or around the mouth. They're caused by the herpes simplex virus, or HSV, and usually clear up without treatment within 7 to 10 days. Symptoms of cold sore. You may not have any symptoms when you first became infected with HSV, the primary infection. An outbreak of cold sores may occur later and keep coming back, recurrent infection. However, if the primary infection does cause symptoms, they can be quite severe. In children, symptoms of the primary infection are most likely to develop in children younger than 5 years old. These include swollen and irritated gums with small painful sores in around the mouth. This is known as herpes simplex gingivostomatitis. Sore throat and swollen glands, producing more saliva than normal, high temperature or fever of 38 degrees or 100 degrees Fahrenheit or above, dehydration, feeling sick, and headaches. In adults, symptoms of the primary infection are rare in adults, but are similar to those experienced by children. You usually have a sore throat, with or without swollen glands. You may also have bad breath and painful sores in and around your mouth. These can develop into ulcers with grey or yellow centres. Ugh. If you developed HSV at the early age, it may be triggered periodically in later life and can cause recurring bouts of cold sores. After the primary infection, the symptoms are usually reduced just to cold sores themselves. When to get medical advice. If you have cold sores, you can get advice and treatment directly from a pharmacy. Speak to your GP if the cold sore has not started to heal within 10 days. You're worried about a cold sore, think it's something else. The cold sore is very large and painful. Treatment. Here are the do's and don'ts. Do's. Do eat cool, soft foods. Wash your hands with soap and water before and after applying cream. Avoid anything that triggers your cold sores. Use sunblock lip balm, SPF 15 or above, if you're outside in the sun. Use an antiseptic mouthwash if brushing your teeth is painful. Take paracetamol or ibuprofen to ease pain and swelling. Both come in liquid form for young children. Do not give aspirin to children under 16. And drink plenty of fluids to avoid dehydration. Here are the don'ts. Do not touch your cold sore apart from applying cream. If you do, wash your hands. Do not rub cream into the cold sore. Dab it on instead. Do not eat acidic or salty foods if they make your cold sore feel worse. Treatment from a pharmacist. If you get cold sores, a pharmacist may recommend creams to ease pain and irritation, antiviral creams to speed up the healing time, and cold sore patches to protect the skin while it heals. You can buy electronic devices from pharmacies that treat cold sores with light or lasers. Some people find these helpful, but there have not been many studies to confirm if they work. If you regularly get cold sores, use antiviral creams as soon as you recognize the early tingling feeling. They do not always work after blisters appear. Treatment from a GP. If your cold sores are very large, painful and keep coming back, your GP may prescribe antiviral tablets. Newborn babies, pregnant women, or people with a weakened immune system who have cold sores may be referred to a hospital for advice or treatment. What causes them? Cold sores are usually caused by the HSV type 1. In most cases, the virus is passed on in early childhood. For example, when a child is kissed by a family member or a friend with a cold sore, the virus passes through the skin and travels up the nerves, where it lies inactive or dormant until it's triggered at a later date. Cold sore triggers. Things that can trigger a cold sore outbreak include having another infection, having a high temperature, emotion upset or psychological stress, tiredness and fatigue, an injury to the affected area, and strong sunlight. However, in many cases, there is no obvious trigger for an outbreak. Type 2. Sometimes cold sores can be caused by the HSV type 2. Preventing. It's not possible to prevent infection with the HSV or prevent outbreaks of cold sores. However, there are things you can do to minimize the spread of it. Cold sores are at their most contagious when they burst or rupture, but remain contagious until they're completely healed. Avoid close contact with others until your cold sore is completely healed and disappeared. However, there's no need to stay away from work or miss school if you or your child has a cold sore. Our final part is complications of cold sores. Cold sores are usually mild, but many cause complications in rare cases. Dehydration sometimes occurs if drinking fluids becomes painful. Young children are particularly at risk of becoming dehydrated. Skin infections. Other complications of cold sores include skin infections. These often happen if the virus comes into contact with broken skin, such as a cut or graze, or skin condition such as eczema. Herpetic whitlow. This causes painful sores and blisters to appear on and around your fingers. Time for our bedtime bird. Oops.